The prostate, which is congenital in every man and begins to grow with age, due to changes in hormone balance, significantly reduces the quality of life. Studies have shown that 50% of 60-year-old men and 90% of 80-year-old men have benign prostate enlargement. 1 in 12 men develops prostate cancer. What causes prostate cancer? What should we do to prevent prostate cancer? And how can those who get rid of it? You will find the answers to all these questions in this video. First of all, what is prostate? The question, what is prostate, is usually perceived as a disease name among our patients. This gland, which weighs about 18-20 grams, tends to grow with age. It is often faced with problems, cancer, and infections due to the enlargement of the prostate. Benign prostate enlargement begins after hormonal changes in men. It is not possible to say a certain age limit for benign prostate enlargement. It does not appear as a disease in every man. Although the prostate is an organ that we see in every man, it does not always tend to cause disease. So, what are the causes of prostate? Since it has a hormonal background, it is not always possible to prevent prostate diseases in advance. The important thing is to recognize and treat the problems in the early stages. So, what are the symptoms of prostate? Frequent urination, not being able to empty the urine as easily as before, slowing down the forward flow rate of urine, the feeling that there is still urine after urinating, blood in the urine, unexplained pain in the genital area, decreased amount of excretion, come to mind as some of the symptoms of prostate diseases. An enlarged prostate is not always problematic. Although there is a perception that the larger the prostate, the more diseases or complaints it causes, this is not true. The size of the prostate and the complaints it causes are not directly proportional. Now let us answer frequently asked questions. Then, we will give good nutrients. Try to consume these plants. It will both prevent you from getting prostate, and if you have it, it will make a great contribution to you. First of all, very curious questions. Does having sexual intercourse cause prostate enlargement? First, let's start with the answer to this question. Prostate gland enlargement has nothing to do with the frequency of sexual intercourse. This enlargement can be seen in those who have sexual intercourse frequently or infrequently. Contrary to popular belief, prostate enlargement has nothing to do with issues such as libido. So, what kind of complaints does benign prostate enlargement cause? Frequent urination, urgent urge to urinate, straining to start urination, intermittent or thin urination, incomplete emptying of the bladder, dripping after urination. These complaints are among these complaints. Now let's move on to answer another question. Is waking up at night to urinate a sign of prostate disease? No. If the patient wakes up to urinate more often at night than during the day, and especially at night, it is more likely to be related to heart failure, nocturnal polypory, diabetes, medications. Of course, this should be investigated by an experienced urologist. Now we move on to answer another question. Does benign prostate enlargement always lead to difficulty urinating? No, it does not. Benign prostate enlargement starts in the tissues around the urinary ducts. If the enlarged prostate grows towards the urinary ducts, patients will have urination complaints. If the enlarged prostate is away from the urinary ducts, the patient will not have urinary complaints, even though the tests show an enlarged prostate. Now, we move on to the answer to another question. Is there a relationship between the size of the prostate and urinary complaints? No, there is not. If the prostate enlargement is directly into the urinary ducts, the patient may have serious urinary complaints even if the prostate is not very large on ultrasound. On the other hand, if the prostate enlargement is away from the urinary ducts outside the prostate, the patient may not have urinary complaints even if the prostate is very enlarged on ultrasound. So, which diseases other than benign prostate enlargement cause difficulty urinating? In a man over 50 years of age, when urination complaints begin and tests show an increase in prostate size, it is assumed that the urination complaints are due to prostate enlargement. This is one of the biggest mistakes. In addition to prostate enlargement, overactive bladder, neurogenic bladder, urinary tract infection, prostatitis, urethral strictures, bladder cancer, distal urethral stones, and foreign bodies in the bladder can also cause similar voiding complaints. If you are misdiagnosed as having an enlarged prostate, you may not benefit from the treatment and may even undergo unnecessary surgery. When should a patient with benign prostate enlargement be operated on? If the patient's urination complaints do not go away despite medication, and the complaints are shown to be due to an enlarged prostate, the patient should be operated on. In addition, surgery should be recommended for those who have recurrent urinary tract infections due to enlarged prostate, recurrent bloody urination, and deterioration of the kidneys due to inability to urinate. What happens if a patient with benign prostate enlargement avoids surgery, even though surgery is necessary? There are two factors that affect urination function: adequate contraction of the bladder and an open urinary canal. Benign prostate enlargement can cause obstruction in the urinary duct. When the urinary ducts are blocked due to benign prostate enlargement, the bladder begins to contract more strongly to overcome this blockage in front of it. At this stage, the patient does not have many complaints. Later on, the bladder muscles start to get tired and the bladder cannot contract sufficiently. The answer to another question: are there medications that can stop the progression of prostate enlargement and save the patient from surgery? Benign prostate enlargement is a progressive disease. As the patient gets older, his prostate continues to grow. Most of the drugs used in the treatment of benign prostate enlargement are aimed at improving the patient's complaints. Only 5 alpha reductase group drugs have the effect of stopping the progression of the disease by 15-20% and saving patients from surgery. So, does prostate enlargement turn into cancer? Prostate enlargement and prostate cancer are two different diseases. There is no relationship between prostate enlargement and prostate cancer. However, prostate enlargement and prostate cancer can occur simultaneously. Therefore, patients with benign prostate enlargement should be screened for prostate cancer and should not be neglected. And now, let's talk about foods that are good for the prostate. Make sure to consume these. Water. Actually, water is the beginning of everything. Be sure to consume 1.5 or 2 liters of water a day. Nettle. It reduces the symptoms of enlarged prostate gland and is even a natural diuretic. Add a teaspoon of dried nettle leaves to a glass of hot water. Steep for 10 minutes and strain. Drink this tea 2 or 3 times a day, or take a nettle supplement. Corn stigmas. Like nettle, it is a natural diuretic and relieves the symptoms of an enlarged prostate. You can put 6 fresh corn stigmas in 4 glasses of water, or 15 drops of corn stigmas juice in a glass of water. You can drink this water daily. Apple cider vinegar. It serves to shrink and tighten swollen prostate glands and helps prevent diseases such as urinary tract infections. Pumpkin seeds reduces the size of the prostate and prevents enlargement. You can prevent this disease by consuming a handful of pumpkin seeds a day, carrots, tomatoes, and grapefruit. These foods have been shown to reduce cancer cells by 18%. In addition, lycopene, which is abundant in tomatoes, is known for its cancer-preventing properties. Whole grains. Whole grains containing protein destroy tumor growth in patients with prostate cancer. Grain foods protect the patient from constipation. Selenium. Selenium levels are high in foods such as fruits, vegetables, eggs, garlic, and seafood. These foods reduce prostate cancer by 50%. Oil seeds such as hazelnuts, almonds, and walnuts. It is beneficial to consume about 30 grams of these seeds in the daily diet. Try to consume plenty of fruit. Yes, this concludes our video. Please do not forget to like and share our video to benefit others, and subscribe to our channel by commenting. We wish you all a happy and healthy life. Goodbye.